Buprenorphine for the management of chronic pain. This is, you don't have this pamphlet, this is a previous pamphlet. This is put out by the manufacturer of Suboxone. And it said in there that people with a clinical need for pain relief should not be transferred to Suboxone. Suboxone film is not indicated for the treatment of pain. About half of my patient population on Suboxone are people that I'm treating for chronic pain. Am I doing something illegal? Am I a bad guy? Am I doing something underhanded? No. Remember now, in reviewing, buprenorphine originally developed in the UK as an IV pain medication. Still used IVIM and transdermal in Europe for pain control. Used by vets in an oral form for the control of pain. I got a show and tell for you here, another show and tell. Medication bottle. Animal Care Hospital. Date, 2/24/14. Patient's name, Tom Olstein. Tom's my cat. Tom had to get 2 teeth pulled last year. The medication, buprenorphine oral. They came as in 6 pre-filled syringes, no needle, just like a pediatric thing. Buprenorphine. Give contents of 1 syringe dropped under tongue or in cheek every 12 hours for 3 days for pain control. Has anybody ever tried to give a cat any medication? Has anybody ever tried to give a cat a medication under their tongue? I only tried it once. And then it was just in the cheek. But buprenorphine for Tom. Tom did great. So, again, the use of buprenorphine for pain control. In lower doses, buprenorphine, very potent. 1 milligram of injected buprenorphine is equal in potency to 15 to 40 milligrams of morphine. I'll pause on that one for a second. Let that sink in. Sublingual buprenorphine is not approved by the FDA to treat pain. Bold. However, buprenorphine is used very extensively off-label. Again, we said off-label is okay. Here's an article. Again, the article that I'm quoting from here. This is from 2005. Sublingual buprenorphine is effective in the treatment of chronic pain syndrome. They took 95 patients with chronic non-cancer pain. All patients had failed previous treatment. And 8% had opiate addiction. They treated them all with buprenorphine or buprenorphine naloxone. 86% of patients had moderate to substantial relief of pain, accompanied by improved mood and functioning. Patient and family satisfaction robust. Only 6 patients had to stop because of side effects or the pain was worse. In this open-label study, buprenorphine naloxone, well-tolerated, safe, and appeared to be effective in the treatment of chronic pain patients refractory to LTOA, long-term opiate analgesic therapy. When I put somebody on buprenorphine for pain, I tell them there's about an 85 to 90% success rate with it. And that matches up with this. I've had some people, I had one guy had to stop it, bad side effect, bad allergic reaction. Other folks, they didn't get the pain control. But 85 to 90% success rate to treat chronic pain. Columbia University, buprenorphine program for addiction treatment, but they also say chronic pain management. This is from Columbia University's website. Suboxone, an opioid effective pain medicine, used this purpose for many years, mostly injectable. They say it's now available, but it's been available since 2003, as an oral medication. They say 15 times, same number I quoted before, 15 times more potent than injected morphine. Medication is different from other opioids. Remember the partial agonist piece? Different from other opioids so the client feels more clear-headed. So you can have pain control and be clear-headed. So having done all that, this is a shameless plug for what we do here. What do we do at Scottsdale Treatment? Well, we do medication. We do education. That's what we just did today. Counseling, group therapy, stress management, medical assessment, and then nutritional assessment and therapy. So this is what we do as part of, it's not just medication-assisted treatment, it's medication-assisted treatment. That's the other pieces of using medication. And then I want to leave you with this. This is the third time you're seeing all of these quotes, but that's the message I want to leave you with. Medication works. It's important. It makes a difference. That's the end.